Basic universal social security measures, such as these pensions being issued in South Africa, are investments in people and save lives. Policymakers need to realize that measures like pensions are affordable in developing countries and are an effective way of improving the health and prospects of very poor families. Pensions here in this Durban township are not just for older people, but for the young as well. They're a lifeline for 67-year-old Teresa Ndlovu. Here she queues with thousands of others to collect her 740 rand a month, with which she has to support her 7 grandchildren. Both her son and her daughter died of AIDS, leaving her to raise them.
I can't do anything if I haven't got pension because I was working before. Now I'm old and I'm not working anymore. I'm just staying at home. I could stay here and die with the little ones without having food. If we have not having pension.
Of the 1.5 million AIDS orphans in South Africa, more than 60% are cared for by their grandparents. Throughout Africa, there are 11 million AIDS orphans who could benefit from pensions and other forms of social security. In another township, 66-year-old Gasta Nsizwani needs more help to raise her 2 abandoned grandchildren. She should be able to get a child support grant for her granddaughter Sizeka, but because Sizeka has no birth certificate or any proof of identity, the grant has been denied. Officially, she doesn't exist. Often, the poorest cannot afford or cannot access ID papers because they live too far away or the systems are too complex. So, simply providing people with an identity is one way governments can reach the chronic poor.